Now with ischemic stroke, what we'll do here is divide it into focal versus our global. What do you mean by focal? Well, focal means that you have an individual blood vessel that is undergoing some type of compromise of blood flow to the brain. How did it occur? Oh, maybe the patient had some type of thrombi formation taking place in the heart, secondary to, let's say, atrial fibrillation. And if you remember, atrial fibrillation would be one of the criteria for developing a thrombi, and in essence, the Virchow triad. Imagine now that you have a thrombus formation taking place in left atrium. What may then happen? At some point in time, if there's, let's say, AFib, then the thrombi will break off, you embolize into left ventricle, and there you go. And 10% of the time, you might end up in the carotids. And if you do, focally, you might then embolize and create an ischemic type of stroke. It could be embolic, meaning artery to artery, or maybe the patient started having a DVT. Maybe it was a female who was obese and was smoking, also taking estrogen therapy. Develops a deep vein thrombosis. But how is that going to result in having a stroke, which is on the systemic side? Obviously, there has to be communication taking place from the systemic veins to the systemic artery. So you begin with a deep vein thrombosis, think of that please. You'll then embolize to the right side of the heart, and then maybe there was an atrial septal defect. And so therefore, paradoxically, you'll then embolize to the left side and end up in your focally a blood vessel, bringing about stroke-like symptoms. Similar topic, ischemic stroke, specifically focusing upon one blood vessel at a time. How did it become pathological is the question that we're answering, aren't we? About thrombotic. Once again, you have a thrombus formation, but this time, it's not in the deep vein of your leg, nor is it in the left atrium, but maybe it's actually taking place in a blood vessel in the brain. Due to, well, years have gone by, and the patient has hyperlipidemia. So atherosclerosis. And there might be atherosclerosis, therefore causing decreased blood flow perfusion to the brain. Or a combination of lipohyalinosis. What does that mean to you? You know what hyalin is, an aggregation of protein. Oftentimes, you know that a patient may have hypertension and diabetes mellitus at the same time. And so therefore, lipohyalinosis. What's happening here? There is a thrombus formation taking place in your blood vessel, and therefore resulting in decreased blood supply to the brain, and giving our patient, unfortunately, a focal cerebral type of ischemic stroke. Or the patient has vasculitis. And by vasculitis, we refer to something like, temporal arteritis, you've heard of before. Arteritis, or maybe something like your granulomatosis with polyangiitis, formerly known as Wegener. Microscopic polyangiitis, you get the point. Or even something like IgA vasculopathy, formerly known as Henoch-Scheinlein purpura. All of those conditions have what in common? They're causing inflammation in the blood vessel. Then what then happens to the caliber of the lumen? Oh, it's getting compromised. This is not good. May result in what? Good. A focal type of ischemic stroke. Are you seeing this now? Or it could be cryptogenic. In other words, not exactly sure as to what the cause is. So on this side, it'll be focal type. And then on this side, globally, what may happen? Well, globally, your patient may be suffering from hypotension. Globally versus focally. So if the entire body is undergoing hypotension, then there's going to be decreased blood supply, obviously, to the brain. Once again, causing an ischemic type of stroke, but this is global in nature. Keep that in mind.